It's my distinct honor to introduce our keynote speaker, Dr. Elizabeth Bukusi, who came to join us all the way from Kenya, from Nairobi. She received her medical degree and master's in ObGyn at the University of Nairobi, did clinical training at Kenyatta National Hospital. She earned a certificate in international health, her MPH and her PhD, her doctorate in epidemiology from the University of Washington. She has a diploma in research ethics from the University of Cape Town and a master's in bioethics from the Sind Institute of Urology and Transplantation. She is the chief research officer at KEMRI, the Kenya Medical Research Institute. She's the chair of the Bioethics Society of Kenya, and she holds faculty positions at the University of Washington, Aga Khan University, and UCSF. So I was Googling around, trying to see what I could find, and I found an article in the Star. And this was from when you were awarded the HIV Biomedical Research Special Award, the second person to receive that award. And I thought they did a brilliant job of citing your accomplishments. They said, few exceptional individuals in Africa invested their lives, careers, and resources to achieve this remarkable success toward the path to zero new HIV infections, zero AIDS-related deaths, and zero HIV stigma and discrimination. The receipt of this award by Professor Elizabeth Bukusi was different for many reasons. She is the first African scientist woman to receive this award at the continental level. Elizabeth has made significant contributions to the science and development of biomedical HIV prevention interventions in Africa through active involvement in the initiation, design, and implementation of HIV prevention research conducted at the continent. She studied female-initiated methods of HIV prevention, such as pre-exposure prophylaxis, microbicides, and multi-purpose prevention technologies. She has been a co-investigator, site investigator, and principal investigator of innovative behavioral research that includes structural interventions to address the needs of young girls, adolescents, and members of fishing communities. For most African advocates, she is remembered for her passion, integrity, and dedication in ensuring that HIV research addresses the needs of Africans. She has trained and mentored more than 55 young African researchers and countless advocates, and she has 4 sons and 2 grandchildren, 4 grown sons and 2 grandchildren. Now, I do this with permission. I was Googling around, and I found an interview with Dr. Bukusi on Kenyan television.
She has an MBCHB, she has an M.MED, MPH, PhD, she's a research officer at KEMRI. She holds an honorary faculty appointment in the Department of the Obstetrics and Gynecology at the University of Nairobi, a professional research position with the University of Washington. And that's just like, I haven't even gone, like that's just me scratching the surface. She's not here to talk about anything education related, but she's here to talk about weightlifting. Hi, Elizabeth.
I'm very well, thank you.
Thank you so much for coming onto the show.
You're most welcome.
Now, we saw you trending, a picture of you trended. Did you expect it to trend, and how did you?
No, I certainly did not expect it to trend.
Yeah, so tell us about, you going to actually, working out so much to the point that you're now, weightlifting.
Well, I wouldn't call it working out so much to the point of weightlifting. Mm-hmm. I would say that I was in the process of working on my fitness goals, and my personal trainer, who's called Frank, suggested that maybe I should enter the competition to give me a goal to work towards. I wasn't very enthusiastic because I'm a quiet person, so I wasn't looking for crowd attention or anything, and I thought I probably won't get very far anyway. So he kept suggesting it, and I thought, well, since it's within my goals to get fit, and it's not costing me anything to register, I can register, I can show up, but I didn't expect to get this far, to be honest.
Now, first of all, can we share your age?
Certainly, you can share my age.
You're 59 years old.
No, I am 57, I'm turning 58 tomorrow. I'm the same age as your president.
Aha, yes. All right, so we got that wrong. unfortunately, we got that online.
We're birthday mates.
Your birthday mates.
Tomorrow.
Clearly. Oh, tomorrow.
Yes.
So we should say happy in 30 minutes, that is.
Yes.
So we should just start sending in early birthday messages,
Yes.
right? And wishing you, just a fantastic 58th birthday.
Thank you.
At that, I mean, what drove you, because a lot of 58-year-olds are not going out to do this.
What drove me? Well, in terms of staying or getting fit, I teach Sunday school. My church is Nairobi Chapel, and I teach a class that's called the Crossroads class. And every year, at the end of the year, we have a camp where we take the children. It's part of their transition process. And I need to be able to keep up with these 13-year-olds. They're pretty fit for the majority of them. They're young, they're enthusiastic, and I need endurance. So part of what has kept me trying to stay fit is just to be able to keep up with them.
I'm going to stop the tape there. One other short anecdote about Dr. Bukusi. She had heard that I was getting over a cold, and she brought me a box of tea this morning. So very sweet. Thank you very much. Please join me in giving Dr. Bukusi a very warm welcome.
Good morning. Thank you for that really, really kind introduction. And I guess I shall never lay down the issue of my weightlifting, because it's going to be the one thing that will probably stalk me the rest of my life. But I really feel incredibly honored to be here with you this morning. And I really want to thank the organizers for inviting me to talk with you this morning. Craig, who's been my friend for many years, tells me I like to tell stories. And I hope to be able to tell you a few stories this morning about how do you eat an elephant. But before I start, I'd like to ask you to do something for me. Let me first ask, are there any two students who are brave and who are willing to volunteer to do something for me? The first two that are up, there's a hand right up there. Please come. And a second person, please. All right, the young man there, please do come. Let's give them a hand. They're really brave. Please come right up onto the stage. Come right up. Okay, I'd like one of you on my left and one of you on my right, because we're going to do something that I want everybody else to join us in. So I'd like you to do something for me, because I think it's going to help us think about how we have a shared future. If I say 1, I'd like you to put one finger up. Could you do that? 1. All right? If I say 2, I'd like you to put your left hand over the finger of the person who's next to you. 2. Can you get that done? So this is the right, and this is the left, okay? So 1, can we go again? 1, and then 2. All right. Now, when I say 3, this is what I'd like you to do. Would you try and grab the finger of the person who's on your left, but at the same time, make sure your finger doesn't get grabbed by pulling your finger out, okay? So let's try that, okay? So let's go. 1. Why are you putting your hand over someone else's finger? All right, 1, 2, and 3. Whose finger got caught? Okay, let's try this one more time. One more time. Okay, but now I'm going to tell you a story, all right? Now please listen for the ones, okay? One day, all right, I took a walk, and I met 2 friends. Now, how Hindukan's missing? What happened? Huh? Let's try again. One day, right, I took a walk. I met 2 friends who told me that they had 3. Okay. Who managed to catch a finger? Oh, well done. Okay, great. Now, because you're so brave, and I'll give you first choice, would you like some coffee or some tea?
I'll take coffee.
All right, and you get the tea.
All right,
Thank you for volunteering. Okay. So the topic I was asked to talk about really thinks about community, and I hope now that you've managed to capture or not capture someone's finger, and I know right now we're all averse to touching anybody else, that it does remind you that we do have a community and a shared future. We are part of this together. I'd like in the next few minutes just to be able to talk about what does it mean to have this shared future, and how can we start thinking about what we can do differently. I've worked for the Kenya Medical Research Institute for almost 30 years now. And in these 30-odd years, I've had the opportunity to have lots of collaborations, to have been trained, to have grown, and to have affiliations with very many different institutions. And I count myself extremely privileged. Let me talk about my country, Kenya. We are known for the big five, the animals that draw many crowds, and many people come to see what they're like. But the elephant is particularly majestic. And even though we say that the lion is the king of the jungle, I can assure you, very few lions dare to tangle with an elephant. So what do we mean when we talk about eating an elephant? And I hope that in the next few minutes, we can have a shared conversation about it. An elephant is something really big. It's something that would be challenging to tackle on your own. It's something that you need to be able to figure out, a little bit like climbing the mountain. Mount Kenya is the second highest mountain in Africa, but it's the one mountain that to get to the top, the highest peak, you actually need to do a technical climb. Unlike Kilimanjaro, that's a long, long trek. The third highest peak of Mount Kenya, Point Lenana, you can get to without any technical expertise whatsoever, but it is difficult. So how do you eat an elephant? I hope to tell you a few stories that will help you think about it in 3 different ways. One, I think you need to know yourself. You need to be the best that you can be. Secondly, I think you need to map to find your calling. Where is it that you can best utilize the talents and the gifts that you bring to the table? But third is about mentorship. How do you build a critical mass of individuals who can work with you and who can work beyond you and go on to help make you achieve the future that you hope for? Please allow me to tell you a few stories from my past that I hope will illustrate this and help us think about how we eat an elephant, but also how do you climb a really difficult mountain. Even though we live with ourselves, self-knowledge doesn't come easily, and we can't always identify who we are and what we need to do. High school for me was one of those places because I was made to learn poetry. And I'm so glad the dean talked about her interest in the literary sciences because I was a very reluctant student of poetry. But this one, the Song of the Battery Hand, one of the ones I had to learn during high school, reminds me that I felt like an individual lost in a morass of humanity, wondering, will I ever even matter? Will anybody even recognize me? Or am I like one of those battery hens in the middle of a world of sameness where nobody can tell you apart from anybody else? And all that you hear is the speaking that happens inside your head, and you don't know if anyone ever hears you. Interestingly, this helped me prepare for a future in research, even though I didn't realize it. But let me backtrack a little bit before I got to high school. I was one of 5 siblings, the 4th in a family. We were born in such quick succession, one year after the other. Before my parents had figured out what to do with one, another one had shown up. So following each other so close in age meant we have a lot of opportunity to play together and a lot of opportunity to discover. My mother then taught me a very important principle, the principle of collective responsibility. Because she couldn't quite always figure out which one of us had been up to the mischief, she had a rule. If one had done it, everybody was responsible. So you got the consequences of either being the one who did it and everybody paid for it, or you answered the question, where were you when your sibling was doing it? Or if you said you were not there, why were you not there when they were doing it? So any which way, we all paid for each other's crimes and each other's joys. Similarly, we paid when one of us had something to celebrate, we all celebrated. And so we learned very early, do it together and do it well, or don't do it at all because you still get to pay for it. Childhood brought with it some enormous opportunities for really having fun. being challenged to jump from the top of a roof, trying to learn how to wash a cat because it had not had a bath, and learning that you get thoroughly scratched in the process. But it was an opportunity that helped me think about science and what I needed to do. But you know what? I blinked, and suddenly, high school was upon me. Just like when you're climbing the mountain, suddenly you figure out that life has changed. And you're climbing up a peak that may be a little bit precarious, but you can't go back because there are others behind you. You have to keep going. So med school came soon after high school. And then thereafter, I was working at a district hospital on the border of Kenya and Uganda. And there, for the first time, I faced the HIV epidemic. In my first year of work as a young medical officer, we would discard 1 out of every 10 units of blood. We didn't have the rapid testing mechanisms then. People were simply bled, then we tested the blood thereafter. We never bothered to test for malaria. There was so much of it, we simply transfused people but gave them prophylaxis to ensure they didn't get malaria from the blood we're giving them. By the time I had been there for 2 years, we're discarding 4 out of every 10 units. And I recognized the challenge of HIV. In a sense, my elephant confronted me then. Soon after finishing my residency, there are 3 wise men that came into my life. Craig Cohen, who's sitting here, was one of them. Alan Ronald, the doctor in the Regal Red, had been mentored by King Holmes earlier when he was doing his fellowship in infectious diseases. Alan is the one who suggested to Craig that he should come and find me. Craig had come to Kenya and was working on some projects looking at pelvic inflammatory disease and HIV, and he needed someone to work with. Alan and I had had conversations a couple of years earlier than that. So Alan told Craig, go and talk to this young ObGyn who's like you, and maybe she might be willing to work with you for a while. Actually, Craig didn't ask me to work with him indefinitely. He only asked me to sit in the clinic for 2 weeks because he had to travel back to the US to attend his brother's wedding. 26 years later, we are still working together. What started as a collaboration of 2 young ObGyn who did all the work themselves. We drove ourselves and our 3 staff to clinic. We came back in the afternoon and entered all the data ourselves. We did what we could to process specimens, grew over the last so many years, and to date, we've had many different staff members who've worked with us. Currently, we have well over 1,200 different staff working on different projects and expanding HIV care in the areas that we worked in. We've called it the Research, Care, and Training Program. Why the 3? Research, because that was our entry. We're looking for opportunities to expand HIV prevention or to provide better care for individuals. We were physicians to start off with. Care, because in the early years, there actually were no opportunities to treat HIV. We used to talk about home-based care, which was essentially death with dignity, providing individuals with care that enabled them to die, hopefully peacefully, and helping their relatives not get infected in the process. But when the PEPFAR program came up, it was inevitable that we would also seek a grant to be able to expand care to those who came to our research programs, but because they were positive, they could not participate in HIV prevention trials. And training, because we learned very early. Each one of us only had 24 hours. And at the end of those 24 hours, there was a limit to what we could do. But we could have a multiplier effect by working with other individuals who then would be able to make a difference. So we've had a long history of many different studies that have gone on, and I only show you the first of them, looking at different areas of preventing HIV, of expanding care, of other health challenges that young women and men in low resource limited settings have. Which brings me to another poem I had to learn as a child. This one's called a freedom song. This poem was written by a British woman who got married to a Kenyan man and came back to live in Kenya in the early part of our independence, in the early 60s. She talks about Atieno, a young woman who has very limited resources and limited education. And because of her circumstances, she ends up working as a domestic worker in the family of a relative of hers. Nobody tells her about her sexual and reproductive health or rights. She ends up getting pregnant. She dies of postpartum hemorrhage and leaves behind a child who will likely follow exactly the same pattern that she has had. The sad thing for me is that this poem was written 50 years ago. It was true then. But the sad thing is it's true now. Atieno still dies in my country. The reality is not only does she die of postpartum hemorrhage, she's likely to have acquired HIV in the process, or she ends up with a sexually transmitted infection and then can't even have any children, faces domestic violence and all manner of things. So 50 years on from our independence, life is still the same. But it's not just about Kenya. There are Atienos even here in your country. They may not go by that name, they may not have that gender, but they're still marginalized and they still have challenges with just basic information, reproductive health rights, and access to basic care. My country, Kenya, is still in the top 5 of countries that have the highest burden of HIV. And sadly, we have not yet had a good handle on this epidemic. We are particularly worried about young women aged between 16 to 24. And because of the socioeconomic circumstances, they really are exposed to new infections in that country. And so long as we have those young women getting infected, we cannot stop mother-to-child transmission. The epidemic in Kenya depends on where you are. The dark blue that you can see, the area around the lake where we work, is still the heart of the epidemic in Kenya. So let me talk a little bit about our comprehensive HIV care program, as we're talking about mapping, finding what can you do and how can you make a difference where you are. We realized that we needed to collaborate and have capacity building within a community that improved HIV outcomes. Jaron Mipena, a Canadian physician, and Reson Marima were the first 2 individuals who championed the program that we call Family AIDS and Education Services. Our program was based, essentially, on trying to make sure we had a platform for research, but that we provided care to individuals who needed it. It was in an area that had very minimal infrastructure, difficult roads, and a very challenging terrain. The epidemic was raging. There were many caregivers, many breadwinners who died and left behind them vulnerable orphans. We recognized that we needed to improve infrastructure to be able to provide care and also to be able to ensure we had a platform for doing research. So what was so unique about this model? This is the nice part of it. It wasn't just about an individual, it was about a community. For each index person, that we would test the community around them, their family, make sure everybody got tested so that everyone who needed care would come into care, and those who were HIV negative could be provided with opportunities for HIV prevention. Ensuring that we made appointments where people came together to reduce family expenditure, maximize support, and reduce stigma. We also built capacity for sustainability, working with the Ministry of Health to make sure that it wasn't just our teams that had the skills needed, but we expanded it to make sure this could be an ongoing feature. We've created adolescent-friendly centers because adolescents are a difficult group to reach, and also made child-friendly environments where individuals who are coming in with their families, there is something for the children to look forward to come to, not just to come and pick pills. So FACES has been a collaboration that has targeted the community and capacity built and ensured that we can expand care to those who really need it. We are happy to really say that we know that there are well over 60,000 individuals who are alive today because of the program that has been running for the last many years. And many people whose families and livelihoods have changed as a result. But in this process, we discovered something else. There were some individuals who, regardless of what we did, they just didn't seem to be able to take their medication. They just were not adhering. And we realized another problem. Food. They were food insecure. They had challenges with just being able to meet their basic needs. And because we said take medication after eating, they couldn't take the medication because they didn't have anything to eat. This gave birth to a study that we are currently just about to finish, but I want to share with you the results of the pilot work we did early. We call it Shamba Maisha. Shamba is about a farm. Maisha is life in Kiswahili. It was based on the fact that we do know that food insecurity and the HIV epidemic have strong overlaps, especially in sub-Saharan Africa. And we recognize that there's a vicious cycle that stops people from being able to have enough food because they don't have enough information, they don't have the skills, and then they can't produce enough. Then, because they can't eat enough, they can't adhere. And the cycle repeats itself, just plummeting them into an abyss where they become very, very helpless. We partnered with an international NGO that works on making availability of pumps for irrigation, and a microfinance organization, a bank, that was going to be the one that was administering the loan. We had a transdisciplinary team of individuals who were able to work on this particular program. And our goal was to be able to see, could we reduce food insecurity? Could we ensure that there was nutritional improvement, both for an individual and others in their household? And at one point, we were also going to be able to evaluate for the young women within those households, did it make a difference that their families had received an intervention? Let me share with you the results of the initial pilot that we did before we even started the major work. We are winding it up in the next 3 or so months, and we hope that we'll be able to share the results of the major randomized cluster-driven trial shortly. There was clearly a reduction of food security in the pilot at 12 months. The cross are the individuals in red who are part of the control, and the blue circle are individuals who are in the intervention. Similarly, at 12 months, CD4 counts were different between those who received the intervention and those who didn't. One might say, well, CD4 counts are not such a good measure. Yes, but even viral suppression were really able to show a clear, distinct difference between the intervention and the control group. But importantly, when we measured self-confidence, those who were part of the intervention were a lot more confident. We recognized there was improved clinic attendance, they were adhering better, they were able to access fruit and vegetables that they were able to plant or even buy, they were less distressed, there was more hope, and there was less HIV stigma. Let me share a few quotes from these individuals that will help illustrate it. They looked healthier, so they felt a lot better. They had hope. In addition to that, they really were very glad that they were able to get up and be part of a community to do the regular things that people did. This actually helped reduce a lot of the stigma, where people were able to identify individuals by an emaciated look, that once they were looking better, people stopped stigmatizing them. There was increased autonomy when they were able to make decisions because they were financially more independent. And for us, delightfully, there was reduced violence, even within the families, because often finances were a source of stress. But this really improved their outcomes. So what did we provide? It was simply a pump, the ability to get a loan of $175 that included the pump, training, fertilizers, and seeds, and training them not just in agricultural literacy, but financial literacy, literacy that is rarely given to individuals elsewhere anyway. And this really made a difference. But let me turn our attention the next short while I have to go back to where we started, which was HIV prevention. This was a question that was on the table for a long time, and I know you know with me that the news is already out. The jury is out on this one. HIV prevention, a pill a day can keep HIV away. For us, it was the joy of being part of the group that did show that among discordant couples, HIV prevention was possible by the HIV negative partner taking pre-exposure prophylaxis. And the PrEP journey in Kenya has been very interesting because we went on to do demonstration studies that showed elimination of HIV transmission beyond the clinical trial that we had done. And then been part of the country as we have implemented the WHO guidelines and ensured that we could start providing PrEP to scale. The Ministry of Health in Kenya very quickly took up the WHO guidelines, and we have had a variety of partners who've been implementing this in a number of different ways. With a strong social media campaign targeting different groups to ensure that people could make choices about protecting themselves. Are you prepped? It really has been an honor to be part of a group that can see right from the beginning of doing clinical trials to finding something that works and then implementing it and raising it up to scale. Not many researchers get to be that honored and have an opportunity to go that far. But you know, the first point of someone taking PrEP is getting tested. And we have communities that have been persistently difficult to find and very challenging to reach. And because search was one of the things that was studies that was specifically mentioned in the invitation letter, I wanted to just give you a peep of what the Sustainable East African Research for Community Health did. A randomized clinical trial of 32 communities in both Kenya and Uganda. And I want to just show you what community health testing was able to achieve. We would enumerate these communities and figure out where everybody was living, and then take the community health campaigns right close to them, where they didn't need to go far in order to be able to get tested. And those who didn't come to the community health campaign, we then followed them by going to where they lived to give them an opportunity to get tested. And in the heat map, you can see the colors gradually getting into blue and green, meaning everybody within that community, 99% were able to know what their status were. Beyond testing, we're linking individuals to actual same day or soon after initiation of antiretroviral treatment, but also providing PrEP for those who needed it, showing very clearly that we could go way beyond the UNAIDS initial 90-90-90. So it is possible to reach people, test them, provide them with options. Again, interestingly enough, still talking about mapping your community, we found there's some women who were very difficult to find. You tested them the first time, and then you couldn't find them again. And our question was, where did they go? The area we work in is around the lake that's shared between Kenya, Uganda, and Tanzania, and we realized there were a lot of migratory patterns. Women moved from one place to the other, not just within Kenya, but also within the East African region. And our question was, where do they go to and why do they go? In a nutshell, we recognize that there are many aspects of women's lives that put them at risk for HIV. Before they migrate, after they migrate, and even at the places that they go to. Widowhood, separation or divorce, gender-based violence often make women move from one place to another. They're exposed to HIV either at risk at the places that they're in or the places that they go to because of their lack of economic power. This is not just typically what we think about in terms of sexual work. It's not commercial work. Often it's transactional. And one of the challenges that we're still trying to figure out what to do with is the sex for fish economy that happens around the lake region. Because it is still rampant, and it's something we have not been able to get a handle on. The men have the power because they fish. The women are dependent on the men for them to be able to make a livelihood. And we're still hoping to be able to find something to do. In the last few minutes, I want to turn to mentorship. As Tom mentioned, I got some of my tertiary training at the University of Washington. And we learned from our initial mentor, King Holmes, that building capacity is a really, really critical part of being able to grow your community and being able to make a difference. Craig and I have been mentored by King and by others whom I haven't illustrated on the slide. But we, in turn, have had the joy and privilege of building networks and mentoring many other young individuals. And I'll only share a snapshot of just a few of these individuals who we've had the privilege of working with. Let me start with Dr. Rison Marima. She came to us as a young medical officer, having just finished her initial training. She worked with us on the FACES program. She went on to do her master's in pediatrics. Currently, she's the director of the Botswana University of Maryland HIV care program, expanding care in Botswana and really make a difference where she is. I want to talk about Zachary Kwena, a medical geographer who came to us after doing his master's in geography and was very interested in working in the fishing communities, and he has been a lead social scientist for us in many different studies. Zachary went on to graduate with his PhD from the Kenyatta University. He is very well published, a very quiet spoken man who really used to even have challenges standing in front of a crowd. But now he stands up and makes jokes about how challenging he finds it to talk in front of a crowd. Franklin Ochiri was our first trained biostatistician. Franklin didn't come back to Kenya after his training, but he is making a difference where he is, at Seattle's Children's Hospital. Raphael now has a PhD in laboratory sciences. When Raphael was doing his grade, or his primary school as we call it, he never knew that he would even make it to secondary school. He had a challenge with tuition fee and reported very late to start his secondary schooling. He used to read by a little lamp that was filled with kerosene, wondering if he would ever even get to university. He did his master's in pathobiology at the University of Washington, his PhD at the Jomo Kenyatta University of Agriculture and Technology, and now is one of the lab leads at the CDC Kenya office. Ibrahim Daud, who's the last of the ones I'll talk about to any extent, is a young man from northeastern Kenya. That is where we border Somalia. When Ibrahim goes home to visit his relatives, people ask him, "How is Kenya?" Because they don't even know that they're part of Kenya. Ibrahim not only finished his PhD, but is distinguished and recognized in many places where he served. And right now, he works with the US Army Walter Reed Project as the lab director in Nairobi. And I could go on about many other of our scholars. Thomas Odenyi, who's right now at the NIH Cancer Center doing his fellowship. Marciano Onono, who finished her PhD just last year at UCSF in policy. On the right-hand side, there's Irene Juguna. Below her is Patrick Oyaro, who are currently starting their PhD training, a link between University of Nairobi and the University of Washington. Nyawira, who's right in the middle here, who is finishing her PhD at Jomo Kenyatta University and works on adolescence and disclosure and transitioning adolescents from adolescent and child clinics into adult clinics. And Eliud Akama, who we are very proud of because he is one of the first nurses that we've trained doing an MPH at the University of Washington, and is going on to work on implementation research. And there are many such stories. Climbing a mountain is difficult, and it is challenging. But if you don't have a network that's going to help you do it, it's very easy to quit when you're on your own. In 2012, we made history by being able to take the largest group of individuals who have ever climbed Mount Kenya and gotten to the top of Lenana. Of the 72 individuals that I took up from our management team, 68 made it to the top. I can assure you it was brutal work, and many of them regretted why they had ever even come to work for us. I heard them saying to each other that they would tell their children that if they ever saw an advertisement linked to either Dr. Bukusi or Dr. Cohen, they should not apply. But many years after, I have now heard them say that when times have been difficult, they've looked back to the bitter cold that you feel up the mountain, the nausea, the challenges, eating food that feels like cotton wool, and recognizing that they made it to the top. They're able to pull themselves up literally by the bootstrings and say, "I'm tough enough, I can make it." Which brings me to my very last poem before I end. If by Rudyard Kipling, another poem that I had to memorize while in high school. You know, if you can trust yourself and not doubt, if you can dream but not allow dreams to be what is your master, if you can make sure that even when what you've worked for is broken, you can still pick up and start again. If it doesn't matter whether you're walking with a high or walking with a lowly, that you can keep going, then indeed, there's nothing on the earth that you will not be able to conquer. I blinked, and the 5 of us who were once children had grown up into older people, much to my surprise. And I've also had the joy of being able to raise 4 grown sons, and now I have 2 grandsons as well. Tom has already told you about my journey into weightlifting, but it did let me know that the sky is not the limit. I can always learn. There's always something new. There are always new horizons that I can push myself up to. I didn't think that I would get to the finals. And perhaps the only reason that, well, one of the only reasons that probably it got me famous was I was the oldest competitor at 58, 16 years older than any of the other young men or women who were competing. But you know, it does remind me that learning never stops. There are so many individuals that I want to thank who've been part of my journey in enabling me eat my elephant, in enabling me identify my elephant, in helping me tackle the challenges that this elephant has provided for me. Because I'm in LA, I cannot forget to remind us that life can be short. But it's not about the length of your life. It's about what you do with it. One of my sons, David, was very inspired by Kobe. And he actually adopted a 24 jersey when he was playing basketball in high school. And it made a difference to him. So you can impact not just the people immediately around you, but beyond. And my question to you would be, will you find out what your elephant is? Where can you make use of your gifts and your talents? How can you build a critical mass of individuals who will help you be able to do the work that you need to do? Because I know that each and every one of you here can find your elephant and you can eat it. I have hope and trust that you will make a difference to my grandsons, Leo and Amari, so that they will live in a better world because of what you do. Thank you very much.
Let's give another warm round of applause to Dr. Bukusi. We are going to open the floor up for a brief question and answer session. So if you have questions for Dr. Bukusi, please feel free. We have about 7 minutes or so. And if you do have these questions, we have microphones set up here, so feel free to walk up. Or if you trust your ability to project, please just stand from your seat once we call on you.
Looks like you've all eaten the elephants. There are no questions. Should I take a couple of questions before? Just go for it. So, challenges that I have had. Indeed, there are many challenges. I'm really glad that you have a female dean, because one of the things that I've learned in my years of working in science is that sometimes being a woman means you get targeted for certain things. And people ask questions of women that they never ask of men. I can see many nods. A couple of years ago, a colleague to whom I stood up just because he was a bit of a bully and was giving people a hard time, and I said no to him, and he found it very hard to take the no. So he managed to get me hauled up to Parliament to answer questions which were not legitimate for things that I actually had not done. The challenge is when you're called up in front of politicians, it has nothing to do with fact. It's all good. Oh, I'm sorry. Hope I'm not being insensitive here. My apologies. So, in Kenya as well, it doesn't have anything to do with facts. It's simply got to do with people's emotions and feelings and what they think. And I must say that the things that helped me are just what I've said to you. One, it was a community around me that had helped me be who I am, my siblings and my family who really stood by me. It was a track record that I had of having been a person of integrity who lived by what I said. And the community of science also came up around me. The map that I had, the individuals that I had worked with really stood up to support me. And in the end, it was not just the work they did, but I was exonerated from all the supposed ills that I had done. And I was able to go back to my workstation and not only continue the work, but do even more work than I had done before. So there can be challenges that come to you from the left side, sometimes nothing to do with the actual science. It can be political, it can be advocacy, it can be actually even personal issues. But having a community around you who support you will really make a difference. And the track record that you build will stand you in good stead, even when the darkness comes.
Thank you for coming. Did you come from Nairobi today?
I arrived the day before yesterday, so I've at least had yesterday to feel the jet lag and start getting over it.
Okay. Just a question on how do you scale your, like, how does like the Ministry of Health in a country like Kenya that it's dealing with is like is it an endemic like situation with HIV, and you've done some wonderful research in linking not just the need for the medication but food in dealing with the disease. So how do you take that research and then like scale it? Because I know there's also other. So I worked with Ampath in Eldoret, Kenya. So I know that they had farms, but I don't think that worked for them. And they did a little bit of training and education within the community, but I don't know if you were able to like take that to scale. And your idea of the pump is like wow, you know, I don't know, it's pretty simple, but how do you scale it? It's like, what is the, sorry.
I think I'd better take a second question because otherwise you might run out of time, and then I'll try and answer both of them very quickly. Please go ahead.
My question is, you talk about community a lot. How do we get into your mentorship network?
That's a perfect question. You know, Craig and I are both here. You're in. And Craig asks me to mention GLOCAL, which is an excellent opportunity because it does open up the opportunity for you to work even within Kenya. All the countries that are part of GLOCAL, and you're part of GLOCAL, you have the opportunity to actually be part of our network and be able to expand your research in those specific ideas. But let me answer the question about sustainability and just say, one of the things we also learned early was that involve people when you're starting to work on research. Don't wait until you have results, because by then they're not interested and they move on. So we have always engaged NASCOP, that's the group within the ministry that works closely on HIV, manages HIV, AIDS, and STIs. And even with our Shamba Maisha, we have been involving, not very successfully, but we are working at it, involving the Ministry of Agriculture, both at the national and at the local levels. Because when they recognize you're answering a challenge that they have a problem with, something that they also recognize as a concern, they are much more willing to support you. So make sure you're involving them up front. Don't wait until you have good results to share with them, because by then, it's way too late.